Though most of us know quitting smoking is critical for lung health, the other things that we don't know about lung cancer can rob us of years to come. And there's also that quality of life thing that can disappear when this disease takes over. So Dr. Bibas Reddy from the Center for Cancer and Blood Disorders is here to talk about this disease and also some new treatment options. Hi, Dr.
Thanks for
Reddy.
having me, Hillary.
Absolutely. Merry Christmas to you.
Boy, treating cancer is almost easier than making jewelry.
I know. That looked very complicated,
But
didn't it?
lung cancer is a devastating disease. We diagnose about 225,000 patients a year.
Wow.
About 160,000 pass away from the disease. So it's a very fatal disease.
Wow. Well, so tell me about the importance of early diagnosis and treatment.
Well, the most important thing is prevention, stopping smoking. And if patients have problems, going to visit their doctor. Things like an x-ray can pick up cancer earlier, things like a CAT scan, but mainly symptoms and talking with your doctor.
Okay, so having a yearly physical and all those things really kind of come into play, and just taking good care of your health overall.
Exactly.
In general. Okay. Well, so tell me, what are some of the treatment options that are available if you do find out that this is something that you have?
Sure. That's why early detection is important. If you're diagnosed early, you can be treated with surgery or maybe radiation, be cured of your disease. If your disease is more advanced, so chemotherapy is your only real option, and we can't take it all away.
Okay. So there are options.
There are options, and you just have to talk with your doctor and explore all those.
And so there's a new type of treatment, and I'm probably going to get the name of this totally incorrect.
They're fancy names nowadays.
Abraxane? Okay.
Abraxane's a new formulation on an old drug we had called Taxol. Taxol was a good drug. We learned how to use it, but it had side effects. You had to take steroids before the treatment. There's a possibility of an infusion reaction. So we're always trying to better the treatments we have and improve the responses. Abraxane did that. It increased our response rate by 8% just on the one drug alone. You don't have to take steroids before it. It's a shorter infusion time, and patients just seem to tolerate it better.
Oh, well, that's good. That's nice to know that new things are being developed all the time to help with the treatment. Well, so what kind of things have you seen, in your own practice, how this has affected people's lives and how you've been able to help them sort of overcome the disease?
We've had a lot of experience with Abraxane and breast cancer, and the patients who had it for breast cancer did very well with it in general. Of course, every chemotherapy has possible side effects, but now we're excited to expand it to lung cancer and try to give those decreased side effects and increased benefits to patients.
Well, good.
Yeah.
Now, what do you say about secondhand smoke? Because for those of us that aren't smokers, I mean, we are still subject to it, and things are getting better as far as, where people are able to smoke.
Now with the new rules and, changing the smoking rules in different institutions like restaurants and bars and things, I think that's decreasing the exposure, but it's always important. If a family member smokes, the first thing is to try to get them to quit. If they are going to smoke, maybe ask them to take it outside, especially to children. We don't want to expose them.
Absolutely. Well, good. Well, this is very helpful to know that there are treatments out there, and then just to remind people that early detection is always, the key.
And keeping your annual checkups, getting your mammograms, getting your colonoscopies. I'd prefer not to have to see patients, and the best way is prevention.
Absolutely. Well, thank you so much, Dr. Reddy. We really appreciate it. Have a great holiday.
Merry Christmas and Happy New Year to you.
Merry Christmas to you, too.